what made you say that you want to try to disrupt healthcare? Was it that, it obviously happened before that cold email you got, right? That this was an tackle.
I mean, no one looks at the economic side of healthcare and said, boy, this is perfect.
Yeah.
We all love it. There's nothing to change here. And so whenever I see industries that are ripe for disruption, I mean, that's what gets me excited. And, the economic side of healthcare was first, it was front and center of being a mess. And, for the most part, it still is. And, the low-hanging fruit was creating costplusdrugs.com because there's absolutely no transparency.
This is Dr. Chethan Sathya. Thank you for joining us for this episode of Northwell Health's 20-Minute Health Talk. Today, I have the one and only Mark Cuban on with us. Need I say more? Mark, thank you for being here with us.
Thanks for having me on.
Of course. So listen, I have to say from the outset, I am from Toronto, so I am a Raptors fan.
That's a good thing. They're not playing so bad. They're a decent team.
True. So, I think across healthcare, I can say we've really been watching what you've been doing to disrupt healthcare. And we're going to get into the nitty gritty of that. I think, you offer such incredible insight. And on a personal level, I'll tell you, working on a number of public health issues, I really do appreciate your pragmatic nature to solving some of these issues. We have to look beyond silos.
Appreciate that.
And so we're certainly going to talk about that a little bit. But I want to talk about your personal journey, right? You started off in Pittsburgh. Tell us a little bit about how you developed such a tolerance for risk and kind of those early moments in your career. I mean, you talk about it a lot, but I'm just fascinated by it.
Yeah, when you're broke, there is no risk. When you got nothing to lose, Damon John from Shark Tank calls it the power of broke. Yeah. When you got nothing to lose, there's only one direction you can go, and it doesn't really matter if you fail or not. I mean, if you fail, you stay broke, and if you succeed, you get out of being broke. And that really was my motivation, to be able to go out there and do unique and different things that my circumstances didn't allow.
And you've been you talk about this, but you've been fired a number of times from your previous jobs.
Yeah, particularly when I was younger, I was not a good employee. I remember working for Mellon Bank, one of the biggest banks in the state of Pennsylvania, and sending a magazine article to the CEO, telling them how they could save money on this, this one thing. I forget exactly what it was. And my boss freaking out, like, what are you doing talking to the CEO? And then another time I called it the rookie club for all the people who had started at the same time I did. And I brought in various execs to go to a happy hour and talk to us. My boss just brought me in and started screaming at me. And that was the end of that job. And, and it was just that type of thing always, where I was always aggressive and adventurous and like, hey, my job is to help you make more money. What can I do? And the bigger the company, the less they appreciated it.
But you're paying it forward now too. I mean, I'll tell you, I emailed you, right? As many others have, and you responded, you came on, you spend the time talking to people. Is that what's infused your sense of kind of paying it back, having these conversations, wanting to change healthcare and improve lives?
Not so much paying it back. It just makes common sense to me. I mean, I make my email available and I've gotten great emails. I mean, Cost Plus Drugs was built around a cold email from my co-founder, Dr. Oshmayansky. And so you never know what's going to show up in my inbox. And it takes me 2 seconds to delete it if it's, a waste of time. And if there's some value there or some depth there, I mean, I've invested in companies where I still haven't met the people yet, all because of cold emails. So I just try to keep that door open because you never know who's going to walk through or what's going to happen.
I love it. And did some of those lessons you learned from those initial jobs you had and so on, I mean, were those, your energy to kind of reach out and do things against the norm, was that stuff that your parents infused into you?
No, I mean, my dad did upholstery on cars. My mom did odd jobs. Neither had gone to college. Neither made a lot of money. And they really just encouraged me to go out there and try things. I mean, my dad, both my parents just said, I don't know what you're doing. I don't understand it, but keep doing it. We support and love you. And so it was, from my parents' perspective, they would always encourage me to do things that they were never able to do. And from there, I just, started growing and building on what I could and learning and taking chances.
Wow. Yeah, I think about it from the standpoint as a parent now too, for my kids. I'll tell you, a lot of physicians, myself included, I mean, I don't think we necessarily have the best risk tolerance.
Yeah.
we're kind of set on a path very early on. It takes you 15 years, and you're here, and then you're like, oh, okay, now what?
Yeah.
And so
Now what? Yeah.
yeah. Do you infuse that into to your children and the way they approach?
Yeah. I mean, I tell them just to be curious, because when you're curious, you get the opportunity to learn new things, and you never know where that's going to take you. Steve Jobs famously said, everything's a remix. You don't have to be original. I'm not, overly original at all, but I know how to take, if I see A, B, C, and D, and I find new ways to combine those to create something that's not currently being done, that's an opportunity. Now, is that being risk tolerant? Not really. I'm pretty risk adverse particularly at this point in my life. But even when I was younger, I would always be cynical and look for ways to kick my own ass. I used to say, be like, okay, how can this screw up? But again, if you got nothing to lose, like I was sleeping 6 guys in a 3-bedroom apartment. It's not like it was luxury surroundings. And, why would I try to mess this up? And for my kids, that's not a problem for them. But I try to get them to be curious and to get them to, explore new things, because you never know where that's going to take you.
Love it. Love it. And I've heard you comment on that quite a bit, right? It's always about whatever industry you're trying to disrupt, it's about the why and looking at the incentives. Yeah. How did you maintain through your illustrious career? How have you maintained the humility to say, hey, listen, I want to listen and kind of still learn? And
there's nobody I know that's going to say that I'm humble, but I am competitive. And I think, that's what really drives me as much as anything. Business is the ultimate sport. Having owned the Mavs, competed in sports, there's always another game, another season, trades, whatever it may be. Players come and go. But in business, it's 24/7 by 365 by forever. And you never know. There could be a kid that works at Northwell, a kid from Toronto, kid from Pittsburgh that comes up with a better idea. And now in a world of AI, that same kid can just go to their favorite LLM and say, hey, I got this idea, put together a business plan, a bill of materials, tell me the best way to sell it, and then, create an agent that goes out there and tries to sell it for them, and do that all for less than $50. And so, there's just so many new ways now to create businesses, and knowledge has become so democratized. I mean, it better than anybody in the medical field. And so because knowledge is democratized, anybody can learn anything. Like when I was younger, I used to go to bookstores, and the books I couldn't afford to buy, I'd sit in the aisles, and just read them right there, or look for magazines and tell myself one idea can, become the linchpin for something unique and successful for me. And so, it's different now. You can go down any business rabbit hole and any LLM that you want to, and create a business in minutes. And I think that opens up the door for risk, the nature of risk tolerance to change, and to really allow anybody anywhere, as long as you have access to a smartphone or a laptop or a library computer, you can be in the worst set of circumstances and fill your curiosity and learn things that can take you into a whole new world.
I love that. Love that. So what made you say that you want to try to disrupt healthcare? Was it that, it obviously happened before that cold email you got, right? That this was an industry you wanted to tackle.
I mean, no one looks at the economic side of healthcare and said, boy, this is perfect.
Yeah.
We all love it. There's nothing to change here. And so whenever I see industries that are ripe for disruption, I mean, that's what gets me excited. And, the economic side of healthcare was first, it was front and center of being a mess. And, for the most part, it still is. And, the low-hanging fruit was creating costplusdrugs.com, because there's absolutely no transparency. We launched January 19th of 2022, and here we are more than 4 years later, and we're still the only pharmacy that publishes a price list. Wow. We're still the only pharmacy that has an API that anybody can pull from. We're still the only pharmacy that publishes our costs, publishes our markup, publishes our fees, and charges everybody the same price, no matter where you are or what the day is. And the fact that that's still unique tells you all you need to know about this industry.
So let's drill down a little bit on cost plus drugs, just for the audience, right? Explain exactly what you're trying to do around pricing for generics.
And it's not just generics and brands, anything we're legally allowed to sell and that the manufacturer will sell to us. And the goal is very simple. You go to costplusdrugs.com, and we want you to be able to trust everything that you see. You put in the name of the medication. If it's one of the thousands that we carry, when it comes up, you'll see our actual cost, what we truly pay for it. Then you'll see that we mark it up 15%. Then you'll see if you have it shipped to you via mail order, we add a $5 shipping or handling fee. And that's it. That's everything. And if our volumes go up and our prices go down, then we pass on that price reduction to you. So that's one core part of our business that patients see directly. Then we have manufacturing in Dallas, where we do make sterile injectables. We're fill and finish, but we focus on drugs that are on the short supply list. You know how it goes. There's pediatric cancer drugs, Pitocin, very common drugs that the legacy manufacturers, I think, I'm guessing here, intentionally let them go on a short supply list so they can increase the price. And we're here to reduce those costs. And we sell those directly to hospitals. So Northwell needs to check us out. Then we also have Cost Plus Marketplace, which is a virtual wholesaler for hospitals and clinics and practices, where we'll sell a wide variety of medications. Again, not just generics, injectables, biosimilars, whatever it may be, to hospitals. And then we've been able to expand our manufacturing. And so my partner, Alex, is really, really smart. And so he's been able to modularize our manufacturing. So we can put them in pods, and we can take our manufacturing and put them in a trailer, like a tractor trailer, and ship it anywhere. So if there's an environmental disaster, if there's something worse, we can send it, and it can do pretty much anything. So, and that's a vertically integrated business.
I love it. Love it. And so when you're partnering with health systems, the value add there, of course, is saving money, right? Around it allows them to actually compete, right? Because they now understand the pricing and so on. Specialty drugs that might not have biosimilars or not generics. How do you partner there?
Well, it depends. So we want to sell every drug we're legally allowed to. Yeah. But in a lot of cases for brand and specialty medications, when the distributor buys from the brand or specialty manufacturer, they literally pay retail for that product. It is the only industry in the history of industries that literally pays retail price all the time, despite being multi-$100 billion companies, Fortune 25 companies. The question is why? Why does a brand manufacturer, specialty manufacturer, sell at full whack, full list price, when if they sold it for less, the distributor would make more, the pharmacy would make more, and most importantly, the patients would pay far less? If those manufacturers sold to distributions at net price, then the distributor could sell to pharmacies at net plus a 5% or whatever markup. Then the pharmacy, when a patient walks in that's uninsured, rather than having paid, whack minus 5% or list price minus 5 to 7%, and only being able to sell to that uninsured or underinsured patient for that price and maybe a little bit more, if everything was done at net plus a markup, all those pharmacies could buy for less, meaning less cash out of pocket, sell to uninsured and underinsured patients for, less than, far less than they're paying now, estimated like 40%. And the crazier part, think about your own personal health care, when you are in your deductible phase and you need a brand or specialty medication, you literally pay full list price for that medication until you reach your deductible. Then it switches to a copay or co-insurance. So if the net price is $300, the list price is $600, that's $300 in margin. Doesn't go to it's not savings for the patient. It's not savings for the pharmacy. It's not savings for the employer. It's not savings for the distributor. That's margin that goes to the PBM for them to choose how they're going to use it or abuse it. They're not saving anybody anything. If they were so good at saving money, they would publish all their price lists.
Yeah. No, listen, I'm a big believer in price transparency. Are you guys working in Canada at all or other countries?
No, not yet, because the pharmacies dominate there. It's not PBMs that dominate, it's the pharmacies. And to try to work with them, you've got to kiss their ass, and we won't do it.
And, you mentioned something else fascinating, right? You actually can manufacture these drugs was it Dallas, you said?
Yep.
In Dallas, cheaper than overseas.
Yeah. And so we have the ability for biosimilars, for sterile injectables, you name it, we can manufacture them now. We're not able to manufacture tablets yet, generics or licensed, because in the US, you have to go to the FDA and fill out an ANDA application for a new drug application. And those applications cost $365,000 each. Now, maybe that's okay for one or two, but when you're trying to do 1,000 of them to change the game, that's $365 million. And literally, if we were able to do it, it would take us 18 months to set it all up. And we can make it in a modular pod, and our prices will go lower and lower as we can buy more API, et cetera. We think we'll be able to get to the point where we could go to Northwell and say, buy one of these pods, basically a trailer, put it in your parking lot, and you can make all the drugs that you need. And in addition to that, we can sell you a second pod that does N of one therapies. And so, again, my partner, Alex, is insanely smart. And we've been able now to put together a pod that historically for rare diseases where you hear the stories of somebody, there's 12 people in the world that have that disease, and the family raises a bunch of money, and they go to researchers, they go to doctors, and they say, please come up with a solution for my child or my parent, whatever it may be. Well, when you get to what you think may be the solution, you have to find somebody to manufacture it. And that typically takes 6 months and $500,000. We've been able to cut that in half in terms of time and cut it down to $50,000. And so we're manufacturing, we're putting together these pods now as a test. And the laws in the US have to change some, but in Europe, literally, I think and I'm not 100% positive, but if two doctors agree that this could potentially solve this rare disease, go for it and you can make it. What's the downside, right? And so we're working with some European outlets to be able to do the N of one manufacturing. And the point of all this is someday Northwell will come to Cost Plus Drugs and buy a pod to manufacture generics and biosimilars cheaper than you can buy them. And for N of one, where you have a very unique set of circumstances, you'll have a pod where you can manufacture that and continuously iterate much more quickly. So if it doesn't work, you go back, you try again, and you can manufacture right there in the parking lot or wherever and be able to take care of the patient far better.
Wow. I mean, that's a serious disruption of the system. I love it.
There's a lot of misinformation, and I think that's where AI plays a big role. Because if you've noticed, when you go to Google, we no longer get those 15 blue links, right? And those 15 blue links, should I get my kids vaccinated? Well, when you had to go down that rabbit hole of reading all those links, you're going to get a lot of misinformation in there. Whoever has the best SEO gets your attention. But if you put that same thing into Gemini now or into Google, which uses Gemini, it'll give you an AI response. It'll kind of hedge a little bit, but the large language models can't be brutally wrong, right? They can't put out misinformation as what their foundational responses. And that is going to, I think, over time, reduce a lot of the misinformation.
The current administration has focused a lot on price transparency as well, right? Whether it be drugs or healthcare services. What are some of the things that I know you're working with them in different capacities, right? What are some of the things that you think they've done in the space that are really potentially transformative, and some of the things that you're not very happy about? And let's just
I don't think there's nothing. Yeah, I don't think there's anything I'm not very happy with. I mean, anything that cuts the cost is a good thing.
Yeah.
But Trump RX is fine. We'll work with them. They have 43 drugs now. We gave them access to our API, so when they're ready, they can release that. So again, there's no downside to it. It's always good. I think Chris Klomp, who runs now HHS and CMS, or not all of HHS, but reports to Dr. Oz and runs CMS. I think what he's done to reduce but minimize the increases that were being paid to Medicare Advantage insurers, I thought that was brilliant. I think they limited to a 0.9%, far less than they expected, but they're gaming the system so badly. I thought it was a brilliant move. I mean, I'm sure you've seen the data that says, Medicare Advantage plans are supposed to be cheaper than traditional Medicare, but we end up spending $76 billion more a year on Medicare Advantage, which is thousands of dollars per family, not just Medicare Advantage family, but per family per year in the United States, taxpayers, and because of all the games that they play. And so I think that CMS, HHS, the president, all are focused on the right things. I don't have a lot of criticisms at all for what they're doing, other than maybe not moving fast enough. And so I think those big insurance companies need to be broken up to allow efficiency to come back to the market.
I agree. Yeah, absolutely. And what do you think about, a lot of talk about the most favored nation kind of push
It's
for drug
fine.
pricing and so on? Is it gonna make a
It's
difference?
not bad. It's not easy. Obviously, there the math is the math and the cost is the cost. And so, if the United States is the biggest market and they want to sustain some margins, then they're going to raise prices overseas in those Western European countries. And so, they pay a price there. But the reality is, I think when you get down to the fundamentals and the math, the biggest difference between the United States of America and brands globally is we have PBMs. Europe doesn't. And those PBMs introduce so much incremental cost that the cost for a brand would be pretty analogous from our market to European markets. And I'll tell you, like I mentioned with Canada, cost plus drugs pricing, and as you know, generic medications are 90% or more of the prescriptions, not that near that much of the dollar value, but in terms of actual scripts. And we're cheaper than the rest of the world, ex India and China, and so, what you might buy, whatever it is you have to pay for out of pocket in Germany, the UK, Spain, wherever it may be, we have people coming to us asking to buy from us, which is counterintuitive to what everybody thinks. But the reality is, where the PBMs are not involved in pricing, generics, we're cheaper. You're seeing that now with biosimilars as well. And so where PBMs are not involved, prices go down. And literally when in reference to MFNs, they didn't need to do MFNs for generics because we're already cheaper than most of the rest of the world.
Yeah. Yeah. Well said. Well said. So future state, 3-4 years, or maybe even in a year, your company, you're optimistic that really you'll be able to scale and bring down prices across the board. That'll lead to a chain reaction.
Yeah. And we've only talked about the pharmacy side. On the healthcare side, we created a website called costpluswellness.com. And where that originated was from me talking to the CFOs of a dozen plus hospitals and understanding the flow of money, just like I got to understand it for pharmacy. And so it all starts with the individual health insurance plan. Well, most people can't afford a $400 emergency check, let alone a $5,000 deductible. And so what ends up happening is the hospital says, we don't want to lose that business. We want to get to the insurance company money above and beyond the $5,000 deductible. So they'll look for third-party financing, but more often than not, the hospital does the actual financing, which in turn turns Northwell into a subprime lender because they know they're not going to get all their money back from all the patients, but they also know that, they've contracted for that hip replacement with whatever their insurance provider is for, let's just say, $35,000. And I know in the Manhattan area, it could go from $82,000 down to $12,000. So all those costs, which we get to see on websites now, are somewhat transparent. But that's where the things start to go downhill for the hospitals in this case. Because so you start off, if a plan holder can't afford their deductible, they got to hope that the provider will help with financing, and they do. But then it gets worse. So now all of a sudden Northwell's contracted with a big insurance company for that hip replacement. And let's just say, for easy numbers, they've contracted at $35,000, and this patient goes in and gets their hip replaced. The insurance company doesn't pay the $35,000 that they contracted for.
Yeah.
They underpay it always.
Yeah.
And then they late pay it always. And then they audit it always. And then they claw back after that audit always. And then you have to deal with pre-authorizations, right? Pre-authorizations are less about denying because when it's all said and done, after appeals, almost every one of them is overturned and approved. Pre-authorizations are more of the time value of money.
Yes. The
longer they can delay, you as a doctor and keep you talking to the 97-year-old pediatrician that hasn't practiced in 47 years, that's running the pre-auth committee, longer they keep you talking, the longer they earn interest on their premium money. But on the flip side, of course, not only have you been underpaid, late paid, clawed back, but now they're wasting your time so you can't see patients. And to make matters worse, to deal with all this mishigas, right? You have got thousands probably of administrators and lawyers dealing with all the paperwork. And then every year they come up with a new number of plans that across all the insurers that you need to implement in systems in your hospital. So they've created all this administrative burden and all this underpay, late pay, clawback financial burden. And so the hospitals aren't innocent. You guys have to claw back and play the same type of games. After talking and learning all these things with different hospitals and providers, I said, okay, what about this? For my employees, let's do a direct contract, hospital, clinic, practice. And here's the deal. One, I'm responsible for patient out of pocket. You don't have that responsibility. So when that hip replacement comes in, if for my company, the deductible is $1,500, and in our case, it's not, it's actually zero, but for our company, if it's $1,500, then I'm responsible for the $1,500 internally. You never see that. By the time we schedule that hip replacement, it's already been approved. So you don't have any concerns about pre-auth or denials. And then whatever price we negotiated, let's just say it's $15,000, the cash type price, I'm paying you cash on the barrelhead right there and then. Or if you want it in 30 days, like some providers and hospitals do, great, I'll pay you in 30 days. That's it. That's all there is. And we have a TPA that then takes the invoice, because it's not really even a claim. You're just invoicing us. So you don't have to put it through all these different administrative paths. Now, for some hospitals, that's been a challenge. But here's the good part. So we're saving a bunch of money. You're actually making more, because your overhead, as it applies to anything that we do, for example, the hip replacement, you're making more money on that. But the best part is, in order to do this contract with us, we have asked, and they've agreed, that we take our contract that we have with you, our direct contract, and we publish it on costpluswellness.com so that any employer can use that contract to direct contract with you on those terms. They can't negotiate the terms, unless the provider wants to, but there's no reason for the provider to, and they haven't. And the fun part of all this, we've gotten far better terms than a lot of medium-sized insurance companies who have gone to the providers and said, why are you giving Mark Cuban companies on costpluswellness.com, why are you giving them a better price? And they tell them, because you late pay, underpay, clawback, pre-auth, deny, and that costs us a lot of money. And so we literally had to put a disclaimer on costpluswellness.com saying that this is only available to employers, because those insurance companies do what you do, and that's too expensive for us. So we think, and by the way, we don't make any money. It's not like you're doing those contracts through us. Mm-hmm. We just open source these contracts so employers and providers have a better flow of patients, and employers have a template to work from.
So just really simplifying the process.
Just making it so anybody can do it. We're doing the upfront work, but you can have 20 employees, 50 employees, 50,000, 500,000. As long as you self-insure, you can use our contracts, or you can even do a carve out and use our contracts for whatever it is you want. It could be MRIs, it could be, ASCs, whatever it might be.
Talk to me. What are the downsides, though, potentially, of price matching? I mean, I've heard conversations on the flip again around, could you, let's say when it comes to healthcare costs, if there was more transparency, is there a world where that actually rises overall cost because people then start to understand and they compete and they start to then price match at a higher cost overall? What would you say to that?
Well, I would say that, like any other product or any other service, that the more educated the employer is, or whoever's making the decision, the better pricing they'll get, or the better relationship they'll have, and the better outcomes that they'll get. So, it's not always price, it's outcomes that you want, the good outcomes that save you the most money. Healthcare is the easiest business I've ever tried to disrupt. Well, the only questions are, how much does it cost? Who pays for it? And what happens if somebody can't afford to pay for it?
Yeah, I love that. I've heard you say that before. And I'm like, everything we hear, I do a lot of work in health technology as well. I mean, you hear over and over again that it's the hardest industry to disrupt. But you've said that. Of all the industries you've dealt with, it's the easiest, you think?
By far. Not even close. Because it's the most undereducated industry I've ever dealt with. And I know that sounds counterintuitive because doctors are so smart, but you spend so much time with health, with education and learning to be a doctor. And some get MBAs and stuff like that, but they're not, they haven't been through the grind. They haven't dealt with it all. And you guys hire so many consultants. I'm like, and, as I started talking about all this direct contracting, and I've talked to more and more hospitals, small, medium, large, I'm like, why do you hire so many consultants? And why is the net result that you can buy almost anything cheaper from Cost Plus Marketplace than you can from the GPO you're using right now? Why are you making it more expensive?
Listen, that's a message I think, again, not speaking on behalf of Northwell, but just for folks across the country, it's going to resonate with people. I was shocked when I got here as a physician, and you're right. We are not educated in medical school and residency about the cost of things, right? We're just not. We talk about cost efficiency, but we're not as a profession. And so I was just shocked to learn, that most health systems like ours, right? We have a high Medicaid population, for example. Our margins, very thin. You're talking less than 1%. And so on the broader issue of public health, right? Vaccines, COVID-19, and so on. Like I said, I think I've been trying to have conversations across the aisle, right? MAHA, traditional public health, CMS doing great work. And I think all too often we're falling into this trap of, I'm seeing a lot of siloed conversations, people not listening.
Yeah, of course.
So what do you have optimism that we're going to be able to find a way forward when it comes to our public health consensus, being able to move forward on a lot of these big issues? Because it is convoluting even our healthcare delivery.
For sure, right? Because there's a lot of misinformation. And I think that's where AI plays a big role. Because if you've noticed, when you go to Google, we no longer get those 15 blue links, right? And those 15 blue links, should I get my kids vaccinated? Well, when you had to go down that rabbit hole of reading all those links, you're going to get a lot of misinformation in there. Whoever has the best SEO gets your attention. But if you put that same thing into Gemini now or into Google, which uses Gemini, it'll give you an AI response. It'll kind of hedge a little bit, but the large language models can't be brutally wrong, right? They can't put out misinformation as what their foundational responses. And that is going to, I think, over time, reduce a lot of the misinformation.
Yes. Well said. Well said. I agree. And I think we're already starting to see that come through in some of these ChatGPT models and so on, and kind of people listening to them, right? And I think...
oh, yeah. I use ChatGPT. Like, I take the levothyroxine, generic Synthroid, and I also need iron because my ferritin levels were low because I went vegetarian. And I had no idea I couldn't take them together until I put it in ChatGPT, then confirmed it in Gemini, and confirmed it in Claude. And it was like, because doctors can't remember everything.
No, we can't.
I mean, you just can't. And 95% of medicine from my outside looking in is doctors hope they see patterns. And then when they're not positive about the patterns or their knowledge base, it's more art than science. And so I think, the AI models will reduce some of the art and increase some of the science, at least a little bit, to make outcomes better.
Yeah. So just to end us off, Mark, your work, again, has been so impactful. You're such a well-known billionaire, right? What do folks get wrong about billionaires? Because I will say you are doing incredible things to try to improve lives. Of course, make money as well. But, what do people get wrong? Because there's a lot of negativity around there.
No, we're not all the same. Like, I'm still the same schlump that grew up in Pittsburgh. I just happen to have a lot more money than I used to. And, my friends are the same. My focus is the same. I've got a plane, so I don't have to worry about the stuff I used to worry about. But still, I'm a big believer that if you were happy when you were poor, you're going to be a lot happier when you're rich. And that applies to billionaires. If they were miserable when they weren't billionaires, they're not going to all of a sudden be, happy-go-lucky, good citizens because they made $1 billion. Everybody's just who they are.
Yeah.
And unfortunately, in some cases, it corrupts some people. I've run into people where their only mission is to make more money, to get higher up on the list. And I'm like, dude, you're not enjoying your life. Do something that you enjoy. And I think, to answer your question, what people get wrong is everybody's going to be different, and money impacts everybody a little bit differently. But if you were happy, before you were a billionaire, you're going to be really happy when you're a billionaire. And if you weren't, you won't.
Well said. Well said. Well, listen, Mark, thank you so much for spending over an hour with us. We need more folks like you in this world. Looking forward to hopefully work with you.
Thanks. I really enjoyed it. It was a fun convo.